Transmedia Collage was an interdisciplinary, intergenerational project that explores how a climate of structural violence has impacted the health and well-being of Black and Brown teens and the communities in which they live on Chicago's South Side. Over the course of 2 years, young people shared lived experiences and thought critically about the social, economic, and political systems that create barriers to individual and community health. A key question of the project was, how can institutions, both public and private, which seek to work in ethical and equitable community partnerships with young people, grapple with structural violence using digital technologies, artistic tools, and cultural forms of our present historical moment? During year one, young people learned from historical archives and participating community elders about the history of their neighborhoods. Working intergenerationally, they read and imagined new narratives about the South Side, one of the largest contiguous African American urban communities in the U.S. They worked collaboratively to create transmedia collages in text, sonic, and visual forms in order to reimagine the pasts of their neighborhoods. They used visual storytelling to speculate what it would have been like living as a teenager during eras such as the Great Migration, the HIV/AIDS epidemic, and the war on drugs to connect the past with their present. During year two, young people were introduced to film production, Afrofuturism, and design aesthetics to construct speculative objects that address current social problems such as police brutality, infrastructural racism, and community health. Working collaboratively, young people then crafted narrative films about those objects and their function. Speculative objects in short films demonstrate how critical making and design can be a tool to alleviate the impact of social inequities on marginalized communities. This interdisciplinary process activated a sense of agency among young people of color over their individual and collective futures. Through the process of articulating and making sense of shared experiences, young people orient themselves within the systems in which they are embedded and elucidate priorities for more equitable futures. Family planning as a discipline engages young people through future-oriented thinking and decision-making related to their sexual health and reproductive options. It is critical to contextualize this process by identifying the current systems which prevent marginalized groups from having access to health information and resources. If given the opportunity to share this programmatic approach, we believe it will disrupt and advance the way global stakeholders work to address family planning as one vital facet of the broad scope of a young person's well-being. And it will ensure that we are equipping young people with skills to manifest the futures they envision for themselves, their families, and their communities.